Welcome viewers to our deep dive into the world of ultrasonography.
Today's lesson focuses exclusively on a critical topic, the absence of a heartbeat in early pregnancy ultrasounds. If you, or someone you know, has experienced this, it's essential to understand what it means and the next steps to take. Key points to consider. The fetal heartbeat typically starts around the 5th week of gestation, but it may not be detectable by ultrasound until approximately 5 weeks and 4 days to 6 weeks. The gestational age can be calculated based on the last menstrual period, LMP, or by using ultrasound measurements. However, ultrasound dating in the first trimester is generally more accurate than LMP, as it is not influenced by cycle irregularities, variations in the timing of ovulation, fertilization, implantation, or inaccurate recall of the LMP. First common example. Imagine a mother who believes she is 6 weeks pregnant based on her LMP. At this stage, we would normally expect to see an embryo with a detectable heartbeat on the ultrasound. However, during the ultrasound, only the yolk sac is visible with no embryo or heartbeat. This could happen because her actual gestational age is closer to 5 weeks. At 5 weeks, it is typical to see just the gestational sac and yolk sac, as the embryo might still be too small to detect a heartbeat. Ultrasound measurements. The gestational sac can be measured early in pregnancy and helps determine the gestational age, but it is less accurate than CRL. This measurement is useful before the embryo and yolk sac are visible. CRL is the most accurate measurement for dating a pregnancy in the first trimester. The CRL measures the length of the embryo from the top of the head to the bottom of the buttocks. This measurement provides a precise estimate of the gestational age and helps in assessing the viability of the pregnancy. Assessment criteria. At 5 weeks and a few days to 6 weeks of gestation, you should see a gestational sac with a yolk sac and embryo. The embryo should measure approximately 1 to 2 millimeters, and the heartbeat should be visible. If the CRL measures more than 7 millimeters and there's no heartbeat, it likely means that the pregnancy has unfortunately stopped developing, which we refer to as a missed miscarriage. If the gestational sac measures 25 millimeters or more without an embryo, it indicates a non-viable pregnancy. What to do if no heartbeat is detected? First and most important, repeat the ultrasound. A follow-up ultrasound in 7 to 10 days is crucial to confirm the initial findings, especially if the gestational age was estimated using the LMP, which can sometimes be inaccurate. Monitoring HCG levels. Regular monitoring of beta-human chorionic gonadotropin, beta-HCG, levels can provide additional information about the pregnancy's progression and help in making timely decisions. Typically, beta-HCG levels should double every 48 to 72 hours in a viable early pregnancy. Declining or plateauing levels may indicate a non-viable pregnancy and can guide clinical decisions during this waiting period. After the follow-up exam in 7 to 10 days, we have 2 scenarios. If the heartbeat is still absent in the follow-up scan, a diagnosis of pregnancy loss can be confirmed. If there is appropriate growth of the gestational sac or embryo but no heartbeat, waiting a few more days for another scan might be necessary before making a definitive diagnosis. Clinical evaluation. Absence of a heartbeat or growth is confirmed on the follow-up ultrasound. In this case, the responsible obstetrician should take one of the following actions. Expectant management, waiting for natural expulsion of the pregnancy. Medical management, using medications like misoprostol to induce a miscarriage. Surgical management, procedures like dilation and curettage or vacuum aspiration to remove the pregnancy tissue. Second common example. 5 weeks without visible embryo. For a patient at 5 weeks based on LMP, it's common to see a visible gestational sac without an embryo. A follow-up ultrasound in 1 week is recommended. Third common example. 7 weeks with embryo but no heartbeat. For a 7-week ultrasound showing an embryo with a CRL of 8 millimeters and no heartbeat, this strongly suggests a missed miscarriage. A confirmatory scan is advised before any interventions. Fourth common example. 5 weeks and 2 to 5 days gestation with embryo and no heartbeat. Detecting a heartbeat at this stage can be challenging due to the early development. It's recommended to await further scans, as the ability to detect it may depend on the ultrasound technician's proficiency, the equipment used, and other factors affecting visibility during this early stage of pregnancy. Fifth common example. Gestational sac containing only a yolk sac, no embryo, with LMP suggesting 6 weeks gestation. It's highly likely that the LMP overestimated the gestational age, and the pregnancy may actually be closer to 4 or 5 weeks. Repeat scans are advised to confirm pregnancy viability. Sixth common example. 7-week gestation by LMP ultrasound shows embryo measuring 6 weeks by CRL, but no heartbeat. It is likely that the pregnancy has not progressed, but it is crucial to repeat the scan within 7 to 10 days to rule out technical issues or difficulty in detecting the heartbeat at this early stage. Feel free to ask any questions in the comments below. I'll respond shortly. For more information and to access other lessons, don't forget to subscribe. See you in the next lesson.